Hello again, and welcome to our video for Module 6. And this module is connected with the chapter in our book focusing on friendship. I think it's a really good chapter. He does a nice job of explaining how friendship fits into natural law, right? And as he talks about, this goes all the way back, at least to Aristotle, where he would distinguish the different types of friends. A whole book of the Nicomachean Ethics is focused on the importance of friendship, right? With the ultimate goal being a friendship where what binds us together is our pursuit of what is truly good, which is really going to fit very nicely with a Christian concept of what true friendship is, right? And I think this is really one of the ways where we kind of get back to that basic point of the whole goal of natural law is not this sort of dry, abstract thing, but it is in fact living out the divine life, right? It is really becoming as much like God as we can, right? And in the Christian understanding, the essence of God is this system of loving relationships between persons, right? And so true friendship is really one of the ways that we as human beings can most be like that, the way that we can really, truly, and totally fulfill our nature. Um, but I didn't really actually find a lot in the chapter that I thought needed elaboration or clarification or uh, critique. So really what I wanted to do in the little bit of the video um, for today is to focus on a couple of key principles of natural law that we haven't addressed up to this point because we've been talking about other things. But there are two principles that are going to be really important for us to be able to understand and to apply as we move into looking at specific moral problems, moral situations, and as you ultimately do your assignments and write a paper wrestling with some big moral issue. So, I want to talk about the principle of double effect and the principle of legitimate cooperation because they are both things that come up quite a bit in modern moral discourse. Right. So first off is the principle of double effect, and this is a really well-known, really widely discussed component of natural law theory. Right, but it is one to make sure we need to get clear on and to avoid some common misunderstandings or misapplications of it. Right. So basically, what the principle of double effect does is it is a framework. It is a tool for working through complicated situations where a moral action is going to have multiple effects, right? And it's going to have effects that are both good and bad, right? And so, how do we deal with situations like that, right? So, when we're trying to deal with questions like should I or should I not steal a candy bar from the store, that's pretty straightforward, right? We don't. There's not a whole host of complex moral reasoning that needs to go into that situation. However, as we talked about in a previous module, can I forcibly take medicine to save a loved one's life when the person who has it is refusing to share it with those who need it, right? That's a more complicated situation. And any sort of action you take or decide not to take is going to have both good and bad effects. Or, should I use potentially lethal force to protect an innocent person from an aggressor? There's going to be good and bad effects. All right, all kinds of situations that we go through in real life are going to have both good and bad effects. Right, it comes up all the time, particularly in medical ethics scenarios. Right, so okay, how does the principle of double effect work? Right, so again, one thing to be clear on from the outset is that this is a framework and not a formula. Right, there's no website at the Vatican where you can type in your situation and it spits out the answer. Uh, Instead, what we have is a way of thinking through and a set of principles that we have to apply as honestly as we can in the situation, and then help use those to help reach our conclusion. Right. So there's four criteria that make up the principle of double effect. Right. So the first one is the act itself or the object of the act can't be immoral, right? So another way of putting this is you can't do an intrinsically immoral thing even if there are good and bad effects, right? And even if the good effects are going to be really great, right? So, intentional murder, intentional abortion, um, is never going to be permitted using the principle of double effect, because as soon as you violate any one of the criteria, then the action is immoral and you ought not to do it, right? So, or another example that came up in an earlier module: can I intentionally attack innocent civilians in a just war? Well, no, right? And the rest of the process of reasoning is a moot point because the act itself is immoral, right? You can't intentionally harm innocent people, right? So that really is the first step, but it needs to be clear. And this is also what differentiates principle of double effect from proportionalism, right? So if you remember, proportionalism would say that in certain extreme situations or in an overall life that is good, particular immoral acts can be approved of, right? And principle of double effect says no, right? If the act itself is immoral, all the rest of the stuff doesn't make it moral. Okay, well, let's assume we get past this first step. Um, the second one is we have to actually intend the good effect, right? So this means you can't um, intended the bad effect and use double effect reasoning as a way of justifying your bad intentions, right? So if you will recall, right, I mean, the basic component of a moral act in natural law is the act as intended, right? So you can't use the existence of good effects as a excuse to do an immoral thing that you want to do, right? So for an example, when in the early or mid 20th century, um, birth control was illegal in Ireland as a predominantly and historically Catholic country. Um, but there are medical procedures where the loss of fertility or sterility is an unintended bad effect, right? So, for example, there are women who need to get a hysterectomy, that is a surgical removal of the uterus, in order to treat serious, potentially life-threatening medical conditions, right? And so those actions, those surgeries can be moral, even though it has the bad effect of the loss of fertility. Now, um, what happened, though, if you look at the statistics from the medical practice in Ireland in certain decades of the 20th century, um, there's a really disproportionate number of hysterectomies being performed in that population. So it's pretty clear that's what is actually happening, is not that somehow people in Ireland are suffering a disproportionate number of very serious medical conditions that require this. But what is happening is doctors are using um, more or less frivolous, but let's even grant that there's a reasonable uh, diagnosis. But really, what they're aiming at is the loss of fertility, right? That this is a backdoor to intentional sterilization, right? And you can't, in fact, morally do that, right? So you have to intend the good effect, not the bad effect. Sorry about the phone. It will stop eventually here. Um, okay, so we can't have an intrinsically immoral act. We can't actually intend the bad effect. We have to intend the good. Step three, or criterion three, is that we have to not get the good effect through the bad effect, right? So, well, what does this mean? It means you can't instrumentally intend the bad effect to get the good, right? So, for example, in lots of ends of life situations in medical ethics, doctors are faced with the challenge of offering more pain medication sometimes runs the risk of suppressing breathing, which might result in a faster death for the patient. Um, so there's this tricky balance that has to be struck in terms of managing pain in such a way that you don't cause the death of the patient, or that you don't increase the likelihood of death to an unacceptable amount. Now, there are situations where you can provide pain relief, pain medications, even knowing that there's a risk that it could suppress breathing in a way that might lead to an earlier death. That can be moral in certain situations if it's the only way to treat a very serious pain. However, you can't treat the pain basically through the death of the patient, right? So there are situations where large doses of pain medication have been given to patients um, with the idea that, well, we have to treat this patient's pain, but really the medical practitioners know that the way they're treating the pain here is through the death of the patient. The patient will no longer suffer the pain because we know this dose is going to actually cause the death, right? And so you can't use the bad effect, death, to get the good effect, pain relief. Um, and so that, again, sometimes this is a difficult thing to sort out, but it is something that you have to consider and make sure that you're not doing. Because if you do that, what you're really doing is intending the death to bring about the good of the pain relief, which we can't do. And then the last step, the last criterion in double effect reasoning, is that the good has to be commensurate to or greater than the bad. Right. So this means that you can't do something that has a very large bad effect for a very modest or small good effect, right? And this is just sort of common sense, right? We don't do a medical procedure that could be a grave risk to a patient's life to treat an ingrown hair, right? Or to treat some very mild discomfort, right? Because that's a really bad effect, right? The potential death of the patient for a very small outcome, treating some mild discomfort. Um, or we don't launch an attack in a just war that is going to likely cause, thousands and thousands of civilian casualties for a very modest strategic benefit, right? So that we have to make sure that the good effect that we are aiming for is commensurate with any bad effect that we see coming from the action, right? And again, sometimes that's going to be difficult. There can be a lot of debate about how to evaluate those different effects. Uh, but this is a guideline, a framework for helping us reason through that. So we want to make sure that we have that balance at least, or that something as close as we can get to the proper balance of good and bad effects. So that is a quick run through principle of double effect. We will talk about that more in future modules. We'll talk about it on the weekend, but I wanted to cover the basics here so that we could dive right into clarification later on. The second principle I wanted to go over just briefly is somewhat similar in nature. It's called the principle of legitimate cooperation, right? And so this is a way of thinking through how do we evaluate our moral actions when we aren't just acting as individuals, but in fact we are part of large, complex social systems or institutions, right? So many of the actions that we perform in the modern world, we perform as part of a corporation or part of a government or part of a church or part of a educational institution, right? And so how do we evaluate our membership in, our participation in these broader systems? And here, the principle of legitimate cooperation is basically a way of, again, not a formula, but a framework for thinking through that. So briefly, the way it works is there are different kinds of cooperation. So let's say there's an immoral act going on in this system. I'm a part of that system in various ways. Do I or do I not have moral culpability? Or another way of putting it is, do I have a moral obligation to remove myself from the system altogether in order to avoid culpability, guilt for the immoral action that's going on? Okay, how do we reason through this? Well, one way of thinking through it is we could say, is it for bleh. So there's material and formal cooperation, right? Formal cooperation, sorry, means I actually agree with the bad thing that is happening, right? And so in that case, I'm a part of this organization doing a bad thing. I actually agree with the bad thing that's happening. In that case, obviously, I share in the guilt for what is happening. And that is immoral, right? I ought not to do that, and I am guilty through that participation in the system. So you cannot do that, obviously. Okay, but when this usually comes up is in situations where I'm part of a system or an organization that's doing a bad thing, but I personally don't agree with the bad thing that's being done. Okay, this is called material cooperation, right? I don't actually formally agree with it, but I am somehow materially connected to it through my participation in the system. How do I reason through this? Right? And this is where there's different levels of material cooperation, right? So one level would be called immediate material cooperation, right? That means I'm kind of like right there in the nitty gritty of the immoral thing that's happening. So let's take a hospital as our institution, right? So let's say this is a hospital that performs abortions, right? So if I'm a medical technician who is working at this hospital and I'm in the operating room handing instruments to the doctor performing the abortion, I am immediately materially connected. Even though I personally disapprove of abortion, I don't agree with it, but I'm standing there handing the guy the scalpels because this is my job. That's immediate material cooperation. And that is immoral, right? I cannot morally do that even if I disagree with it, right? The fact that it's my job doesn't mean that I am removed from moral culpability, from guilt, right? Because I am immediately participating in the immoral action. So I cannot do that. Okay, let's say I'm more removed, right? So this is called mediate or mediated cooperation, right? I'm further away. Um, how does this work? Well, again, there's no perfect formula for how this works, but it would be, if I'm proximate material cooperation, that would mean I'm not like literally right there handing things to the guy, but I am fairly closely involved in what's going on, right? So maybe I am, you know, processing the setting up the drugs for the abortion to be performed, or I am specifically charged with um, setting up the billing for abortion procedures to the insurance companies, right? Where it is, I'm not right there, but I have a more direct connection to the immoral action than many other parts of the institution, right? And so that would be, again, not morally permissible, right? You can't um, have a sort of indirect, if you will, but still close connection to the immoral action that's happening, right? That would mean I need to request a different job in the institution or find a different job. Even though I'm not literally standing there, I'm still involved enough that I ought not to be. Okay, the next step away is called remote cooperation. And this would be, I'm a janitor working in another part. I work in, the geriatrics ward at the hospital, right? I'm a janitor there. I'm a nurse in geriatrics. I have nothing to do with the abortions performed in another department of this big hospital. Um, what about this situation? Well, there's two parts to it, right? One would say it can be moral to have that job or to have that level of participation, but you ought to minimize or eliminate the cooperation if possible. So if I'm that nurse in the geriatric ward at the hospital, um, I need this job. I want to follow my vocation to help people. I don't agree with the abortions being performed by the hospital I work at. If there's an opportunity to get a job at a different hospital that doesn't do these immoral things, then I ought to do that. I ought to move to the other hospital. Or let's say there's not another hospital, but I have an ability to share my views with my employers, to advocate within the institution, then I ought to do that, right? I ought to encourage the hospital, encourage my supervisors. We ought not to be doing this, right? Um, so basically, remote cooperation means it doesn't mean we have no responsibility. It means we ought to advocate to end the immoral action if possible. And if there are ways to remove ourselves from any association with the immoral action, we ought to do that. However, there will be situations where um, we don't have the ability to change what's happening, or we don't have the ability to find a less morally compromised position elsewhere. And if that's the situation, then we can morally be part of that institution, despite the fact that there are bad things going on, right? And this hopefully is heartening for us because I think as citizens of our country, we are all complicit to some degree in immoral actions performed by the state or the federal government. Um, and we don't have to flee the country. We don't have to rescind our citizenship. But we ought to minimize our cooperation as much as possible. We ought to advocate for change. And if we are in other situations, say as an employee or a customer, and we become aware of a morally superior alternative, we ought to pursue that. All right. So I apologize it takes a little time to work through, but I wanted to do that here because I think his treatment of friendship was pretty good, so we didn't need to repeat that. And also because I think it's important to get these principles down as we move into the following weeks in our course, where we'll start wrestling with more specific moral situations, because double effect and legitimate cooperation are going to come up quite a bit as we wrestle with these thorny, complicated real life scenarios. So thank you for your time. Feel free to raise questions or concerns about what's been discussed here in the discussion, and I look forward to talking with you.